We've got another The Itch review for you today. This is where we're joined by Dr. Michael Blaze to break down allergy and immunology studies, helping busy clinicians, patients, and caregivers stay up to date with research. Each episode comes with a one-page infographic for easy reference, so head to the show notes to follow along. Today we're spotlighting a study from the Journal of Advanced Practitioner in Oncology. It asks whether patients with indolent systemic mastocytosis and the advanced practice practitioners who treat them see symptom burden the same way. The disconnect might surprise you. This podcast is made in partnership with the Allergy and Asthma Network. We want to thank Blueprint Medicines for sponsoring today's episode. While they support the show, all opinions are our own and sponsorship doesn't influence our content or editorial decisions. Any mentions of brands is for informational purposes only and not an endorsement. Now let's get into it. You're listening to The Itch, a podcast exploring all things allergy, asthma, and immunology. Welcome back to The Itch Review. Today we are unpacking the article Patient and Advanced Practitioner Perspectives on Symptom Burden and Symptom Management in Indolent Systemic Mastocytosis. This was published May 4th, 2025, and it was in the Journal of Advanced Practitioner in Oncology. I'm going to jump off right here and say, why are we, an allergy and immunology podcast, reviewing an article that was found in a Journal of Oncology?
So the reason we're looking at this article in an oncology journal is in fact this condition that we're talking about today, indolent systemic mastocytosis, very commonly shows up, as we'll talk about the symptoms, in an allergy office. Most of the conditions that we take care of relate to the mast cell, especially when we talk about allergies, because it's the release of chemicals from mast cells that cause the symptoms of allergy. So this is a condition that we're going to talk about today, indolent systemic mastocytosis, that very commonly shows up in the allergist office.
Yes, and we've done a whole series on systemic mastocytosis, so we definitely want to reference that. So there are different forms of systemic mastocytosis, and today we're covering indolent systemic mastocytosis, and that is a form of essentially a cancer that is not growing and is stagnant. So what we worry about when we're thinking about cancers is that once a cell overaccumulates, it starts taking over other functions of the body. So it might go into the liver and take over the entire liver, and that way the liver can't function appropriately. Or it might go into the kidney. It might go all over the body and essentially take over the body and not allow the body to have its normal function. In this form, in indolent systemic mastocytosis, that's not what's happening. And we have a form of disease that is quiet. And that is why it's in the space of allergy immunology. Number one, because it's the mast cell, as Dr. Blaze mentioned. And number two, because it's not a form of cancer that's spreading everywhere and that doesn't require other forms of treatment. That's also why we're talking about it, because it is a condition that allergists, immunologists are getting to know. That is something that we want to spread more awareness and education about, because we do need to be aware of these patients and how to diagnose them appropriately and how to manage them appropriately. This article is focusing more on the advanced provider perspective, but we want every allergist and every advanced provider that works in the allergy space to understand this condition better, because we see it so often and it's coming into our offices. So again, this is a rare mast cell disease. It's estimated to occur 1 in 10,000 to 20,000 people. There are different types of systemic mastocytosis, and the most common is this indolent systemic mastocytosis. Again, mast cells are a part of the immune system, and they actually are found all over the body. That includes the skin, the gut, the bone marrow, especially the brain, the lungs. So they are virtually everywhere in general, but we don't want them to always be releasing the chemicals that they have inside of them. So essentially they're triggered to release chemicals like histamine and other chemicals that cause allergic reactions. And that should only happen when we need that to happen. Ideally, that would only be during parasitic infections, but for people people with allergies, mast cells also release their contents and can cause allergic reactions. Again, there are other types of systemic mastocytoses that are more on the cancer realm. And so when that overgrowth of mast cells progresses to the next level, that's when our oncology colleagues will take over and will be managing this condition. And there might be other therapies that are needed. But we are focusing on indolent systemic mastocytosis today.
People with indolent systemic mastocytosis, as you mentioned, in fact, have a normal life expectancy. But the real difficulty here is that the variability and inconsistency of symptoms that patients present with this condition that really fools us. People with indolent systemic mastocytosis can suffer from symptoms from anywhere from fatigue and flushing, dizziness, headaches, itching, abdominal pain. So they can have GI problems, diarrhea, wheezing. Not uncommon, we hear patients complaining of brain fog, and anaphylaxis occurs in these patients. Not everyone that has indolent systemic mastocytosis has all of these symptoms. We know that somewhere between 30 to 50% of patients with this condition will have anaphylactic episodes. And they have different things that, in fact, can trigger their anaphylaxis. So things like heat and cold and emotional distress. They'll tell us certain foods may bring it on. Not uncommon for alcohol consumption to do it. Certain medications like opioids or NSAIDs, which include things like ibuprofen or insect stings. It's important to note here that people with this condition may in fact be completely well between these episodes. So sometimes when they come to the office, we can't find anything wrong. So these patients end up being seen by multiple specialists, which really, of course, delays that diagnosis. In fact, we have data that the mean time from first symptoms to diagnosis is 3 years. In some studies, it shows it can go as long as 9 years before a diagnosis is made. The other thing is that patients with this condition see an average of 7.3 specialists before anyone gives them the diagnosis. So the problem here is that patients don't get early treatment because it takes so long to make the diagnosis. So on average, these patients bounce between 7 to 9 different providers, can wait up to 9 years before a correct diagnosis is made. And what we see many times is patients here are labeled wrongly that they have allergies or GI issues like irritable bowel syndrome, or even psychiatric conditions, things like anxiety going on associated with this.
This sounds like it's a very tricky diagnosis to have and also to get, because it shows up in so many different places, as you guys alluded to. Is it's not just like one body system that can tell you very clearly what the story is. So I can see why this article is going to be very interesting for us to unpack, because we want to know whether the patients and the people who are diagnosing the patients are on the same page. So why don't we just jump right into it? What was the objective of this study?
So, in order to talk about the purpose or the objective of the study that we're looking at today, we need to explain one term first, which is called symptom burden. So, symptom burden is the overall weight that symptoms place on a person's life. So what that means is that as healthcare providers, we usually think about it in 5 overlapping areas. So frequency, how often the symptom shows up; severity, how intense it feels when it shows up; duration, how long each episode lasts; distress, the emotional strain the symptom causes, which can include fear, frustration, anxiety; and then number 5, functional interference, the practical disruption to sleep, work, relationships, exercise, hobbies, and so on. And so symptom burden is all 5 of these things. We look at them and see how much is this affecting this person. And when those symptoms add up, say symptoms that strike daily, hurts really badly, lasts hours, makes you anxious, and keeps you home from work, that would mean that you have a high symptom burden. Symptoms that are mild, brief, and rare would carry less of a symptom burden. So I just wanted to explain that term because that's a really important part of what this article is about and a really important thing in systemic mastocytosis.
Thank you. That sounds like a really good framework to have, especially as Dr. Blaze mentioned, that these symptoms don't necessarily always happen all the time, but that they do happen infrequently. And so you have moments in your life where maybe it doesn't feel like anything's going on, and then it does happen, and it can be hard to describe that. And I think having a clear framework for when these episodes happen help patients better describe it. At least that's what I'm hearing. So then can we talk about what the objective was?
What they wanted to learn, what they were interested in, was how two groups see indolent systemic mastocytosis. So those two groups were advanced practitioners. So advanced practitioners are healthcare providers that are not doctors, but are able to treat similar to doctors. So the most common types of advanced practitioners that we have in the US are nurse practitioners and physician assistants. So we're looking at those advanced practitioners and also patients who actually have indolent systemic mastocytosis. This was a descriptive study, and the objective was to see, are advanced practitioners and patients with indolent systemic mastocytosis on the same page? Are they looking at this condition in the same way? Are they seeing the symptom burden in the same way? And is there a disconnect between the different perspectives when we look at the management, at the literacy around indolent systemic mastocytosis? Is everyone on the same page or not? And so that's what we're looking at, and that's what we're going to figure out. And it's going to help us understand how this potential disconnect, or are they connected, is showing up in how quickly the diagnosis is made or how not quickly the diagnosis is made, as we discussed.
Great. So this sounds like, from a patient perspective, an amazing type of study to look at. How did they do that? How did they figure out what patients were thinking and what advanced practitioners were thinking?
So, as Dr. Gupta mentioned, this is a descriptive study. So, what they did is they put together a group. This was led by advanced practitioners. It was a multidisciplinary steering committee to, again, evaluate the role of advanced practitioners in the diagnosis, management, and support of these patients that are suffering with indolent systemic mastocytosis. And with that, the steering committee also included not just advanced practitioners, but they had a patient that had indolent systemic mastocytosis. They had a research scientist that was part of a mast cell disease advocacy organization, so they could also evaluate the patient's perspective, as Dr. Gupta mentioned. So let's see how this was set up. So first, they gathered background information. They looked at different research that was already out there related to indolent systemic mastocytosis. They had meetings with experts from different fields and with patients themselves. And what they did is created two different surveys. One, to survey the advanced practitioners that were taking care of patients with indolent systemic mastocytosis, and then a survey to look at the patients themselves that were suffering with indolent systemic mastocytosis. So let's first look at the advanced practitioner survey. What did they ask here? It was to look at how those advanced practitioners see the everyday symptoms of this condition. They wanted to know what tools and methods they use to track and to treat these particular patients' symptoms. They wanted to know how the advanced practitioners work with other specialists as a team in taking care of patients with indolent systemic mastocytosis. And they also wanted to know what gets in their way, what is bothering those advanced practitioners and is preventing them from helping patients with this condition, in fact, feeling better. Now, if we look at the patient survey, the real major part of that comes to us with the use of what's called the Indolent Systemic Mastocytosis Symptom Assessment Form. So that's a long term for a validated instrument. So what do we mean by a validated instrument? It's one that's gone through numerous studies that shows that what it's asking, it truly is getting the proper results. So we have a validated instrument that is looking at patient-reported outcomes. So in other words, this is a survey done by the patients, and in this case, reporting about their symptoms associated with indolent systemic mastocytosis. With this, we can quantify, we can monitor the symptom burden in patients with this condition. So the real purpose of this particular survey, as it's used again around the world, is to help daily symptom severity in the patient's perspective. So patients can, in fact, do this at home and bring the results to the physician. It can also help clinicians standardize symptom evaluation, more than just lab tests, more than just looking at patient's skin with this condition. So to give you kind of an idea of the structure here, there are 11 core symptoms, and we'll go over those in just a minute. And each one is scored from 0 to 10. 0 means no symptoms, and 10 means the worst imaginable symptoms that the patients can have. So we have 11 core symptoms assessed, and they can be divided up into 6 symptom domains. So for the skin, we have 2, itching and flushing. For GI, we have 3, nausea, abdominal pain, diarrhea. For neuropsychiatric, we have fatigue, headache, brain fog. For cardiovascular, dizziness. For muscle skeletal, we have bone pain. And then we have one that's called constitutional, and that is listed as spots. But what we're really talking about here is skin lesion burden. So again, you score each one 0 to 10. So the scores can be anywhere from 0, which would be absolutely 0 symptoms, to 110. Now, also in this survey that they developed for the patient, they wanted to know how bad each symptom was. So they graded also that mild, moderate, and severe. They wanted to know whether they saw different doctors before and after getting their diagnosis of indolent systemic mastocytosis. They wanted to know what made it hard for those patients to manage their symptoms. And they also wanted to try to understand if they understood healthcare information and were able to talk to their care team. So that's what we call health literacy. Now, why does all this matter? And the point here is that by comparing what the advanced practitioners think, what patients experience, the hope here is that these researchers in this study could spot gaps in care, places where we could do better with treatment, we could do better with communication. And so the bottom line here for all of us is that people that are suffering with indolent systemic mastocytosis can, in fact, get the best care, the best support possible.
I love everything about this, I have to say, as a patient who's been to many different doctors, not for indolent systemic mastocytosis, but for something else. I feel like this is something that is a pain point for a lot of patients, is that we feel as though we're not necessarily on the same page or we're speaking the same language as our doctors, because of course we're patients and we don't know the right words. We don't necessarily know how to describe what's going to be helpful for our doctor. So it sounds like everything that they've put in, both for the advanced practitioners and for the patients, really help to understand where everyone's head's at. And I love that they included like health literacy in this to see like how much do patients understand about their diagnosis. So this sounds really, really exciting to me.
Study recruitment is really interesting and can also be a pain point for a lot of studies. And so I'm just going to put a big plug in that patients that want to be involved in studies need to reach out to their physician or patient societies that they're a part of. There's a lot of different studies that are always going on. And if you're interested, you can be a part of them, definitely, because we're always looking for patients that want to be a part of these studies. But anyways, this particular study recruited their patients through the Mast Cell Disease Society, which is a support group for people with mast cell disease. And for the advanced practitioners, they were recruited through 2 professional groups for advanced providers with experience in blood cancers and in mast cell disorders. So there weren't that many advanced providers in the allergy space for this particular study, but the surveys were open from December 22nd, 2024 to February 3rd, 2025. And they had a total of 103 respondents. So 53 of those were patients with indolent systemic mastocytosis and 50 were advanced providers. And they each answered 100% of the questions that were asked of them. So that's great. The advanced practitioners that completed the survey, 56% of them were nurse practitioners, 36% were physician assistants, and 6% were actually pharmacists, and 2% were clinical nurse specialists. So we had a diverse group there, and they worked in different settings. So 66% of them worked in the hematology oncology setting, 43% were in academic centers, and 57% were were in the community setting or remote practices. And then this next part, the experience level of these advanced providers. So 16% of them had less than 5 years of experience being an advanced provider. And then the rest range from 6 years to over 20 years. So this was an experienced group of advanced providers, which is helpful because then they may have seen more patients with indolent systemic mastocytosis throughout their career. And then the 53 patients that were recruited, their mean age was 44 years, and the average time since their diagnosis was 8 years. So they had lived with the condition for a fairly long time. Some of these patients, 38% of them had waited over 20 years to get their diagnosis.
It sounds to me that for the patient base, because they were recruited from a society, I would assume that they have a pretty high health literacy since they've already started their journey on what indolent systemic mastocytosis means. So they're already a little bit more advanced than someone who's newer or in the middle of their journey of finding diagnosis. So I just wanted to bring that up and ask if that is something that is taken into account when they look at the results, that these patients, if they're being evaluated for something like health literacy, they're probably a little bit higher than the average Joe.
I think that's absolutely correct. And I do think when we look at the results, we need to remember that.
So talking about results, what did they find out?
What we need to remember here is the bottom line, as Dr. Gupta's mentioned, is really symptom reduction. I mean, that's what we look at in all the clinical trials with this condition. And the bottom line, what we do as clinicians is to try to make the patient's symptoms much more manageable so that they can have a good quality of life. We have to remember that at this point, we do not have any cure for this particular condition. So with that, what did they find in their surveys? Well, they found out that only 24% of the patients with their disease rated themselves as being well controlled, while the majority, in fact, rated their symptoms as moderately well controlled, which was about 55%, and not well controlled, which was about 21%. Now, in contrast, when we look at what the Advanced Practitioner Survey believed, they stated that over half of their patients with this condition were well controlled, 76%. Now, although most of these advanced practitioners mentioned they only saw anywhere from 1 to 5 of these patients with indolent systemic mastocytosis per year. Nevertheless, over half felt, and that was 54% in this survey, felt comfortable managing their symptoms. So what we have here, I think is clear, is a mismatch between the patient's perception of their control and how they're doing with this condition and how the provider perceives that their patients are doing. Now, part of this may be is that even here, these advanced practitioners really had limited experience with indolent systemic mastocytosis. As again, we mentioned, it is a fairly rare condition. But I think we can take something else from this. This is not uncommon that the clinicians, in this case, the advanced practitioners, feel that patients are doing much better than in fact what the patients believe. And I think a lot of times we hear what we want to hear as clinicians, and we may not be hearing correctly from the patients how much they're suffering with a condition. So we have a clear disconnect here. And I think it's something that this survey brought out very importantly.
Yeah, that sounds like something patients also get frustrated with because sometimes they can't communicate everything they want to in an appointment as well. So they might not be able to get across everything that they're feeling, especially when you don't have a lot of time with your doctor. And this is just a personal anecdote that sometimes I feel like I'm doing just fine when I go see my doctor. And sometimes I feel like I'm doing terrible. So it also depends kind of where you catch me in my feelings that day. So maybe sometimes the patient's doing a little bit better than they did a week ago. So it's always about the timing as well, I think. But it's interesting to have tools that are a little bit more objective, like you mentioned earlier with these different questionnaires. So what were they looking at symptom-wise in this study?
So the key insights from patients was that fatigue was the most common, most challenging, and most unpredictable symptom with the greatest impact on quality of life. And then brain fog was common and difficult to manage, unpredictable, and significantly impacted their quality of life also. Diarrhea was also common and hard to manage and also affected quality of life. Abdominal pain was less common, but was a more severe symptom and also greatly impacted quality of life. And then the spots or the skin symptoms were frequent and unpredictable, but have a lower impact on the quality of life. And then anaphylaxis was unpredictable, of course, and had a moderate impact on the quality of life. That was kind of their list. So that was the patient list. And then the advanced practitioners, their perspective was somewhat similar, where number one, brain fog was the hardest to manage, then blood pressure instability, then abdominal pain, then fatigue, and then itching in their viewpoint. And then the symptoms with the greatest quality of life impact, according to them, for their patients was the itching, so skin. And then number two was fatigue in their eyes. And then number three was brain fog, and then diarrhea, and then anaphylaxis. So essentially, the conclusion from these two lists was that both patients and the advanced practitioners agreed that the fatigue and the brain fog are the key issues in indolent systemic mastocytosis, and that abdominal pain and diarrhea are also things that pose major challenges for this particular group, and that managing the symptom burden and improving quality of life remains to be the central goal for both the patients and for the advanced providers. So essentially, again, this survey is just looking to see, do the patients and the advanced providers see things in the same way? And when we figure out what they're not seeing in the same way, that's when we could make changes to education and the way that we're providing training to providers, and also the symptoms that we're focusing on and helping patients manage, because then we understand for them what matters most. And of course, this is always going to change from patient to patient, right? For some people, the itching might be the primary concern. So another learning point is that we always have to ask our patients, what is the symptom that's bothering you the most and affecting your life the most? And focusing on helping relieve those symptoms as a primary thing that we can do as healthcare providers in order to improve the quality of life for our patients.
That's a really interesting finding. And I feel like as a patient, that's probably quite a relief to know that there is some sort of disconnect, so you're not going crazy when you feel like maybe what you were saying to your doctor isn't what they understood. Just understanding that sometimes there is a gap there and giving both yourself and your doctor grace that you might not be speaking the same language. This is another reason why I think for patients it's important for us to write things down before we go see the doctor, because when you sit there, you don't necessarily remember everything. It's hard to track everything because, I can't even remember what I had for lunch 2 days ago. So how am I supposed to remember all of the symptoms that happened 2 weeks ago, 3 weeks ago? So I'm intrigued. How do they track these symptoms so that they are reporting them as effectively as possible?
And that's a real key here, especially in a condition like indolent systemic mastocytosis, where there are so many different types of symptoms patients can have and they can vary over time. We really need to track symptom burden in these patients if we're going to really evaluate true treatment effectiveness. So the primary tool that's used here again is that indolent systemic mastocytosis symptom assessment form that we talked about previously. This again is used in virtually all clinical trials that involve patients with indolent systemic mastocytosis, but it can definitely be used in the office situation. We can have patients fill this out at home on a regular basis. And then when they do have a visit to their advanced practitioner or their clinician, they can bring that information. So it can be extremely helpful as far as getting the patient the right treatment to control their symptoms. What did we find out as far as the use of this tool? First, in fact, let's look at what the patient said. Only 26% of the patients, in fact, were even familiar with this particular tool, and only 11% reported any consistent use of the tool during their healthcare visits. So, unfortunately, it just wasn't used that often. Now, what about the advanced practitioners? What did they say? Well, 31% of them said that they did use this survey consistently in their practice. 40% though said they used it inconsistently or not at all. And very disturbingly, 20% did not even know what this particular symptom form was. And only 2%, and this is a real problem, had this particular form embedded in their electronic medical record. And the reason is that if you have to scan paper versions of the survey into an electronic medical record, I mean, I see this happen all the time. We get incorrect placement in the system. And very importantly, you're unable to track symptom trends over time. So you can't see clearly in your EMR if in fact the symptoms are getting better or getting worse over time in the patient. So, how should this form then be used in clinical practice? So, 48% of the advanced practitioners said that they use certain items in this form. So, they ask about certain symptoms during visits. But I think we have to realize that that can be a problem because if they're not asking about all the major symptoms that in fact are in this assessment form, they may be missing important symptoms for that patient. And that may lead to the patient not getting the proper treatment that they need. And only 34% consistently documented symptom burden in their clinic notes. Again, this is a real problem because what are we doing with this condition? I mean, we're documenting how well we're controlling the symptoms, but here basically only 1/3 of the advanced practitioners are doing that. So what we see here is we have some real challenges going on in the management of patients with indolent systemic mastocytosis. 54% of the advanced practitioners agreed or strongly agreed that measuring symptom burden over time is difficult. So maybe we need better tools out there. 34% were neutral and 12% disagreed. So we have a lot of problems here, as we can see, as far as the management and following these patients with indolent systemic mastocytosis.
It sounds like that's quite a challenge, is to sneak all of those points in a visit, and especially when there is no consistency. And I know, as I said before, patients sometimes don't realize that one thing might be part of their condition, so they don't think about mentioning it. So not having a consistent tool sounds like it can be very challenging on both ends. And that being said, symptom management is one thing, but don't you need to know how or why or when these things are coming? So do they also talk about triggers?
Yeah, so trigger again is an interesting term that we've talked about a lot in allergy land. But for indolent systemic mastocytosis, understanding symptom burden requires identifying and managing individual triggers, which cause mast cell activation and symptoms. And so, what that means is that understanding what actually causes the symptoms to worsen is super important for patients in order to better manage their condition. And triggers can vary from patient to patient, and they can also change over time for the same patient. So, tracking and documenting triggers is critical for reducing symptom frequency and severity, and especially for preventing anaphylaxis. So, in table 3 in this study, you'll see what triggers were mentioned in the study. So, the top 10 reported triggers, number 1 was emotional stress. Number 2, physical stress. Number 3, food or beverages that were perceived to be triggers. Number 4, heat. Number 5, temperature changes. Number 6, alcohol. Number 7, environmental stress. Number 8, fatigue. Number 9, chemical odors. And number 10, sun or sunlight. So 28 patients reported that their triggers have not been clearly identified. And that's really common in indolent systemic mastocytosis. So I just want to point that out. And because many triggers are part of daily life, patients often, again, experience isolation or feel like they have to be homebound out of fear that their symptoms are going to flare and that they're going to have poor symptom control.
It sounds like it can be a vicious cycle, right? If stress is one of the major triggers, and yet you are living with a chronic condition that you feel like you don't know what's going on, I can see stress being high. And then if, say, something else like, I don't know, sunlight triggers you, you want to stay home and losing your life in, so then you become more stressed. So it sounds like it can be a vicious cycle for these patients with these triggers, and kind of figuring out how to manage their quality of life so they feel better. So I can see why indolent systemic mastocytosis is such a hard condition to both manage as a patient, but also as a doctor if you're trying to get your patient to avoid their triggers, but then that avoidance creates other triggers, which is stress. Now that we have an understanding of who, what, and when of this study, what are the key takeaways for us after reading this and after reviewing this?
What I really took away from this paper and what I really learned was that we have a lot of challenges in measuring of the symptom burden in our patients with indolent systemic mastocytosis. Again, this is a rare condition, so a lot of clinicians are just not familiar with it. The one tool that we talked about is a fairly long tool, and maybe we need the development of alternative tools that are easy for both the advanced practitioner, the clinician, and for the patient as far as measuring their symptom burden. And I think what I really learned from this paper was really those patient-centered barriers and perspectives, that the burden that these patients are having with the healthcare system, having to see multiple specialists before a diagnosis is made, frequent visits, especially related to anaphylaxis. It's not uncommon for these patients to be misdiagnosed. And something else I think I wanted to add related to this that a lot of times we don't think about for these patients is the work disability that they have because of their symptoms, a lot of cognitive symptoms that we've heard. They have travel limitations related to their condition. They may have to avoid certain jobs because it could trigger their indolent systemic mastocytosis, and how this can really lead to strained relationships, lifestyle changes, limitations, as we've heard, related to these patients. So, again, this is a very important condition for all of us to understand and be able to manage.
Yeah. And for me, what I took away from it is just that, in a condition that's rare and that's not being frequently seen by providers, we really have to focus on those conditions sometimes in educating ourselves as providers. And this is just a clear indication of that, because I think that just that 20% keeps ringing in my ears, that these providers that think of themselves as managing indolent systemic mastocytosis didn't know about a tool that is used frequently in research and that should be used in our patients. And so, looking at that particular number, we can just see that we need more education, especially in conditions that are rare. Having that as one thing that we learn from this. And then also the tech part of it. So, understanding that these tools that we have to be able to look at what's happened from one visit to the next and be able to say, is there a trend for things getting better or things getting worse? And so for me, as somebody that believes in telemedicine and using tech as much as possible, I think that this is just another reminder that doing that and embedding these tools into our EMRs is very important, because it allows us to be able to monitor the trends more easily in which direction our patients are going. And then thirdly, I think it's super important to understand that the way that we're looking at a patient's condition oftentimes is very different from the way that they're looking at their condition. And again, their priorities may be different from our priorities. And that's where kind of shared decision making, communication, and understanding that we really need to communicate with our patients to figure out what is affecting their life the most and how can we improve that symptom or that particular aspect of the disease first and foremost, or focusing on the three things, because as we mentioned, this disease involves a lot of different systems. And so sometimes as a provider, we feel overwhelmed in being able to make sure that we're managing every single aspect of the disease, but maybe making sure that we're focusing on the top three that are affecting our patient the most. But again, the only way that we're going to be able to understand that is by using the tools that allow us to see which symptoms are affecting the patients the most.
What really stood out to me when we first started talking about this was the fact that it takes so long for these patients to finally get their diagnosis. And throughout the study, you can kind of hear that when we aren't talking the same language, when there are so many things going on in the patient's life and so many tools that maybe the advanced practitioner does or doesn't know about, I can see how this diagnosis delay can happen, because there is that somewhat disconnect between what's being communicated from both ends. So for me, the biggest thing was I can understand why there is a delay in diagnosis, and hopefully this paper will help people understand where we can shorten that delay. Because of course, when it takes you forever to get your diagnosis, it means that you're not getting the right treatment, right? So your quality of life is down because you're not getting the treatment that you're supposed to be getting. You might be getting treated for something completely wrong because you're getting treated for one thing, like allergies, like Dr. Blaze said, is like they're commonly diagnosed with allergies, but that's not what you have. So again, it's just the idea of getting a proper diagnosis so you can get a proper treatment and you're not spending years doing something that you didn't need to have to be doing for so long.
Thank you, Courtney. That was a beautiful summary. And I think the bottom line is just that this is a rare disorder that we need more education around, and that we just need to focus on figuring out how to better treat these patients and get them to their right diagnosis.
Well, thank you, Dr. G, and thank you, Dr. Blaze, for joining us again on the Itch Review. I'm always learning so much. I just feel like I'm going through my own education here. In 2 years' time, I don't know how smart I'll be, but I have a good feeling about it. Again, I just want to remind everyone we have an infographic in the show notes if you want a little summary to take with you, and that we have a whole series on mast cell disease. So we'll link that in the show notes in case you want to go on a deep dive into the world of mast cell diseases.
Thank you for listening to today's episode. Remember that all information you hear today is for informational purposes only and are not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician or healthcare provider. And also, don't forget to subscribe to our podcast. And if you have a second, help spread the word by rating our podcast and sharing with your friends and family who might also be interested in learning more about allergies, asthma, and immunology. You can always stay up to date by checking out our Instagram, The Itch Podcast, where you can leave questions you are itching to know, or check out our website, which is www.itchpodcast.com, which contains more information about the subjects we covered in today's episode and every episode. Until next time, have a fabulous week.